Alright, so today I am preparing for my next patient for fillers. So I thought I'd quickly share with you my favorite cannulas to use. So 90% of my procedures I use cannula because for me, cannula, lesser bruising, less risk for vascular occlusion, and less swelling for my patients. And also it allows me to feel the area, manipulate the cannula, and fill bigger spaces. So these are my most used. Sometimes I use this, but these are my most reliable cannulas. Okay, so this one has a bigger gauge. This one is 22 gauge, and as you can see, this size is long. So like I said, if I want to fill in bigger areas, I will use this one. Okay, and then I have this 25 gauge, shorter, and this one I also use on the lips. Yes, I can also use cannula for the lips. Then this one is 25 gauge, 1.5. So these are my most used cannulas. This one I hardly use just because 27 gauge, and 27 gauge is can also penetrate blood vessel. You see how tiny it is, so it can puncture, penetrate blood vessel just like needles. So I tend to stay away from this, and this one are just shorter, 27 gauge. Okay, once again, cannula for patient safety, lower risk of vascular occlusion. I'm gonna be demonstrating to you the difference between using a cannula. This is 25 gauge, and this one changes. This is a needle with gauge 30, 29. So sometimes, I backfill syringes, especially for the lips. We use this. I use the smaller needle, so you can see clearly, huh? So this is just for purpose of comparison. Yeah, the balloon does not represent the blood vessel or the artery. So this is the 25 gauge cannula. See, I am not afraid to even touch it. I am not bleeding, and you see it's bendable. This allows me to reposition the cannula, the orientation, and reach farther areas versus a needle, a very short one for that matter. Okay, so we'll try to puncture this glove with water. See what I'm doing? This is because it has blunt tip. It does not poke really, and even if I do this to myself repeatedly, you see I'm not bleeding. And I try that with a needle. It's a different story. See, so I'm doing this forcefully, nothing. Yeah, I can also use this on the lip. I will create a port of entry. I numb my patients whenever I do fillers just for additional comfort, although the filler that we use have lidocaine in it. So say for example, I use a cannula on the lips. I create a port of entry here that will allow me to deposit filler there, HA filler, and once I'm done, and then I tackle the bottom lip. Now for shaping, I still resort to needle because it's hard to shape, especially the cupid's bow if you use a cannula. So if for example I want to fill in my tear trough, yeah, as you can see I need touch up already. I've done my under eyes over 2 years ago, and I need a little bit of filler there already. But my port of entry, 2 ways. Okay, so I can discuss this in another video, but before I even touch the tear trough, so most of the time I build the mid face first, and in my case I have some loss of volume already in my cheeks. So see, when I feel this area and even this area, it moves up. Yeah, so it creates less of the hollowness when I tackle my mid face first. But like I said, we're gonna go to that in a separate video. So but for example, if I am going to use a cannula to fill in a tear trough, my orientation is either I start from here because it's safer and then deposit like that, or if I want to fill in say for example my cheek and my tear trough, this will be my port of entry, and I can deposit filler there in a fanning motion. Okay, versus needle, which I have to do multiple puncture. And as I have said in my previous video, less swelling, less bruising, and I'm all about patient safety as well. We proceed now to the needle. Okay, so this is the needle, 30 gauge. So okay, you see, it's already squirting water, and we did that many times with a cannula. It's not doing that, right? So now you understand my point, why I prefer cannula versus needle. Alrighty, so oh my god, it's Friday. No, it's not even Friday. Is it Friday? No, it's Thursday, but tomorrow is a holiday. So my mind is already blank. I'm already spacing out because I'm really looking forward to a long weekend. So till my next video, okay?